Good afternoon, everybody. My name is Laura Ross, and I am the director of the Port Charlotte Medicare Care Tenders. Can everyone hear me okay? We are a home health agency serving Charlotte County and DeSoto County. I have been the director for 5 years. I do this every week, so I don't really use a PowerPoint. If you don't mind, that's how I'm going to do it. I'll get it all covered, I promise. So I have a staff of RNs. I've been an RN for 39 years. I did labor and delivery for 31 years, and then I switched over to home health, which I absolutely love. So I am located, our office is located in Port Charlotte next to the Port Charlotte Mall in the SunTrust building, okay? My staff consists of RNs. They go out to the home. I also have RNs in the office. I have LPNs, which are licensed practical nurses. They also go out to the homes. I have physical therapists, doctor of physical therapy, and physical therapy assistants, all going out to the homes. I have occupational therapy. Occupational therapy is people that are used, and when I was in the hospital, I really didn't know a lot, especially working labor and delivery, what occupational therapy was. But occupational therapy is so very important in home health services. Those are the people that help the patients adapt to daily living after they've had a stroke or surgery. They help bathe the patient. They help dress the patient. They help the patient learn how to get along in their home safely so that they don't fall. That's so, so important. If a patient falls in a home, they could break a hip, then they go in the hospital, then they go to rehab, and sometimes the outcome is not what we want it to be. So it's very important to also get occupational therapy. We also have speech therapy. Speech therapy is used for patients that have strokes. They have swallow studies. We do that all the time. We also have social services. So we have patients occasionally that don't have resources that they could take benefit from. So we help and get them the benefits that they deserve, most of the time at no charge at all to them. We work with Medicare. We also work with the VA. VA veterans deserve so very much for everything that they did, and often they don't get the benefits that they could take advantage of. So we help them with that. We also take other insurances. I will never tell anyone we can't take you. What I will do is I will run a referral, which means a doctor gives us the referral. We run it. If it says Mr. Jones is going to have to pay $20 every time we go out there to visit him, I'm not going to do that. I'm going to look and find an agency that will take care of Mr. Jones at no charge. So I am not going to take the patient because there should be no charge to these patients. If a patient is a Medicare patient, there is no charge at all to them. If a patient is a veteran, there is no charge to them. Those I can tell you definitely. All the other ones I have to run, and then I'm able to give information. So we have all the services that we need. We have nursing, physical therapy, occupational therapy. Sometimes I get resources from outside of our office. We do skilled care. So that means it's a nurse, it's a physical therapist, it's not a sitter. Often we get the phone call, can someone come and just watch my dad because I'm afraid he's going to turn the oven on and he might burn the house down. Or my dad is forgetting to eat. Can someone go out there and cook for him? We don't do those services, but we have other companies that we do work with that definitely will do those services. Okay? So I trust them. I have parents in the 80s, and I trust them, and they've taken care of my parents. Well, we say there's a lot of home health agencies. What's the difference between Medicare Care Tenders and another agency? Well, of course, I'm going to tell you we're the greatest because I've been there 5 years. But I really want to tell you some of the things that we do that are above and beyond what some of the other companies do. Right now, these are the latest and greatest bags that we use. This is medication do not take, and this is medication do take. I've been a nurse a long time. I have found that patients, no matter how old the medication is, they don't want to throw the medication away. They feel that they have it and they need to keep it. But what I don't want them to do is to take the medication because it's the wrong medication. So when my nurse goes out there or my physical therapist to do that first visit, they're going to separate the medications. So we might say, Mr. Jones, you have a blood pressure pill that I know you took 4 years ago, but you don't need to take it anymore. We're not going to throw it away, but we're going to put it in the closet. So we will put it in the red bag and we'll put it up in the closet. So the patient knows we haven't gotten rid of the medication. They still have it, but they're not going to take it. That way I don't have to worry about them taking the wrong medication, okay? We also have medication boxes. We often go out as nurses and fill the medication boxes so that the patients don't have to. Some patients have vision concerns. I personally go out and see one patient that only wants me. I go out there and I fill out his medicine boxes for 2 weeks at a time. We talk about how he's doing, but he has to use a magnifying glass that is huge, as big as a dinner plate. It's that big, truly. So he could never do his own medications. Those are one of the things we do. Right now, I'm concerned with patients that they make sure that they get enough water, enough fluids, because it's getting hot, they get dehydrated. I will have family members call me and say, Laura, my dad just doesn't feel good. He's really talking crazy. You know, he's never been this way. I'll say, well, how's his intake? Well, I really don't know. He doesn't like to get up and get anything. If a patient at this age, you know, the advanced stages, I hate to say that, but that's what it is. I'm in the advanced stages now myself. If they do not drink enough, they can get a urinary tract infection. A urinary tract infection, believe it or not, can change their mental status, and quickly. So the first thing when a patient is confused and disoriented, I say, how does it feel to go to the bathroom? Tell me what's going on. I just had a patient we've been taking care of for a very long time, husband and wife, and the wife got a urinary tract infection and pulled a knife out on her husband. Never, ever, ever, ever has she ever thought of doing that. But because she has a urinary tract infection, she got confused, and that's what she did. So those are the things that I always worry about, is that they're being hydrated. This, again, will take care of the medications. So it's a take bag and a not take bag. This is also what they can take when they go to the doctor's office. The doctors love it because they don't go in with the Publix bag with 47 different pills. There's a this is one we take and this is one we don't take. So that's one of the tools that we use. Another tool, and this is actually my favorite tool. You know, on TV you'll see I've fallen and I can't get up. Every patient that becomes a patient with Medicare Care Tenders is offered one of these. It's a beeper, just like I've fallen and I can't get up. It can be used as a beeper or it can be used as a necklace, okay? When it's placed on the patient, it's in a standing position. If their position changes from a standing position to a drastic change, they fall. It will go off, okay? When I say it goes off, it's going to be called to our office or to 911, whichever way it's set up. So they get this for no charge. They're normally $60 on TV. I think if you get I've fallen and I can't get up, and you have to do a contract. There is no charge for this. And once they are off of our services, it's $29.95 if they want to stay with it. But while they're with us, there's no charge. This is priceless. The patients love it, and so do the family members. So if I have a family that's in New Jersey and we're taking care of their loved one here, they love knowing that we have this. I think it's great, and I can tell you the one instance that happened. We have a patient that lives in Arcadia. She lives in one house. Right next door, her daughter lives. She got up one day, alert and oriented. She got up one day and decided to go see her daughter next door, but didn't tell her daughter she was coming. She had the little cobblestone walkway. She was walking over, and she fell. When she fell very close to a red ant pile. Her daughter did not know she was coming, but she had one of these on. She did get bit by red ants, don't get me wrong, she did, but she did not get bit as badly as she would have because we had someone there within 7 minutes. So that is so very, very important that the patients feel comfortable having this. Now, it's only going to work if they wear it. If they don't wear it, it's not going to work. It will go off if there's a sudden change in position, but they can also push it, okay? Now, it depends on how we set it up. They might say, I have absolutely no family anywhere near here, so Laura, I want it to come to your house. Okay, that's fine, because I'm on call 24/7. There's never a day or a time that you cannot speak with me, okay? My phone number is on, my personal phone number is on the business card, and if you call our office, it goes right to me. So there's never a time. I've been on call for 5 years, and I like to be on call because then I know what's going on. So sometimes this will go off and it will come to me, and that's fine. Sometimes the family member says, I want to know first, and then I'll let you know. I always put in there the clause that if there's a 911 emergency, we're not going to call anybody but the ambulance to get them there immediately, okay? But that's one of the things we offer. And the last thing, which is so important now, I have a girl version and I have a boy version. But in the day and age of COVID is still around, okay? Even if you're vaccinated, it is still around. We had 2 cases this week alone, which, I'll admit, I kind of got lax and said, you know what, I think we're all doing really good. And then all of a sudden we got 2 patients with COVID. So we are all protected. The staff has plenty of personal protective equipment. You will never have to wonder if we're going to show up to your house with gloves or mask or whatever. We have gowns, gloves, masks. We can look like the Michelin tire boy when we come to your house, and we often do. So we have the equipment, but we do have 2 cases of COVID right now. I keep the same staff members taking care of these patients, so I don't alternate all different staff. They all are willing to take care of these patients because we all protect ourselves. Most of my staff is vaccinated anyway. I have testing at my office, so I can test staff anytime, all the time. So these pipes are very similar if you've ever been to the hospital and had surgery, and they give you that incentive spirometer that it looks like a pipe and you have to breathe. No one likes that. They don't want to take it home. Well, these are the same thing. I have a boy version and a girl version. It's only the color. There's no difference. But actually what I've done is the staff has the pink ones and the patients have the blue ones because we actually demonstrate them when we go to the patients' homes. But this is used for patients that have any respiratory issues. So if they have COPD, congestive pulmonary disease, if they have asthma, if they have recovered from COVID but they still have some breathing difficulties, we use these. The clinician, the nurse, the physical therapist can program this so the breathing is a little harder each and every time so that it expands their lungs. This keeps the patients from getting pneumonia and ending up back in the hospital. It's yours to keep. There's no additional charge, but they work wonders. There's been research done. That's why our company chose to buy these and to give them out to all the patients. So it's a wonderful thing. How do you get one of these? How do you get our services? Well, what happens is you go to your doctor and you say to the doctor, I think I need some help. I'm not quite strong as I used to be. I have to kind of touch the furniture as I walk through the house, or my gait is unsteady. People with Parkinson's, they have like a shuffle, okay? People that have blood pressure issues, their blood pressure goes up, their blood pressure goes down. Vision concerns, all of those things. We also do a low vision program with our patients. We also do a swallow program with our patients. We also do an incontinence program. So a lot of women that have had several babies, they tend to lose a little urine. Not only women, but men do too, but we have a program for that. We have lots of programs. So let's say you go to your doctor and you want home health. You ask them for home health services. They're going to write a prescription and send it to us if you ask them for us. The thing I have to stress, in this area, there's a lot of doctors. They have their own home health services. It is patient's choice who you want to use. So don't let a doctor say, well, you know what, you have to use this service. My father, for instance, and I don't normally talk about my dad is having a total knee replacement in Sarasota on Thursday. Here, his daughter runs a home health agency. The doctor said, you have got to use my agency, no other one. I said, Dad, that's against the law. They can't say that. He says, well, Laura, I don't want to start any problems. I said, okay, Dad. But I will let them know when I see my dad in the hospital the day of surgery, by the way, I run a home health agency. I'd like you to use my company. They're going to tell me, no, the doctor wants his company. But I will tell you it's against the law to do that. You can choose whoever you want. All right? So you get a prescription and you ask them to send it to Medicare Care Tenders. We have 24 to 48 hours at the most to come out there and start your care. The first visit is longer. It's about a 2-hour visit because we have to do a full assessment. We have to do all the medications. We have to get all your history. We need to do a head-to-toe assessment, make sure there's no areas of skin breakdown, all of those things. After that, the visits are usually 30 to 45 minutes, okay? A lot of people ask me, well, how many times a week will you come? It's always decided by the doctor. Now, if I have a nurse go out there and the doctor says once a week, and we go out there and we think, oh boy, we need to be out there more than once a week, we will suggest more than once a week. As long as the doctor approves it, we can do that. We can't do anything without a doctor's order. We will be the patient advocate. We will work with your doctor. So if you say, I want a shower chair or I want a different walker, we will get that for you. You don't have to be on the phone with your doctor all the time. We'll take care of that. A lot of times, like I said, occupational therapy is forgotten. That's a wonderful service that gets you back into working in the house, working in the garage, making your meals, doing your laundry, making your bed, those kind of things. So that's occupational therapy. Is there any questions, anything I might have forgotten to talk about? We do a lot of swallow studies, a lot of after stroke patients, which is so important to do that as soon as possible so that the residual, the effects of the stroke are not as bad as they could have been. Yes, ma'am. No, ma'am. What we do is when the doctor gives us an order, we are with you for 30 days. At the end of 30 days, we will do a reassessment. It's usually 5 days, so around day 25, we'll do a reassessment. Let's say we had physical therapy and nursing out there with you. They would meet with me. It would be your physical therapist, your nurse, and we would decide if you can benefit from more services or have we reached a plateau. If we stay in your house, and this is with any agency, if we continue to take care of you and you are not improving, it is fraud. So we will never do that. We are going to show improvement, or if not, we're going to tell you we've done all we can. So we might say we've done all that we can. Here's some exercise programs. We want you to continue to do those. Let's say 2 weeks after that, something happens. Then we can always go out for another 30 days. But the episodes are what we call it. Episodes are 30 days at a time. Yes? It depends. What happens, and this is how Medicare pays, and this has all changed in the last year. What has happened is, let's say a patient comes with dementia as a diagnosis, and they come with osteoarthritis, which is a hip, and they have Parkinson's, and they have macular degeneration. That's with their eyes. So those are the 4 top diagnoses. We put those in, I put those in because I coded, and they will say, okay, Laura, you have 7 nursing visits and you have 4 physical therapy visits and you have 3 extra. That's when I look at the case and I say, okay, we need more nursing and we need less occupational therapy. So I decide that. I can change that at all, anytime, as long as I get it approved from the doctor. So that's how it works. We can always go to bat to get more visits. As long as I can justify the visits, I can get them. Yes, and yes, ma'am. And we have partners that we deal with. They're not with our company, but we work with them, and we give them the routines and the exercises that we've been doing, where we started, where we are now, so that they know where you want to be. That is usually out of pocket unless you have a clause that is outpatient. And a lot of people do have outpatient. They do. So our servicers are 100% paid for, but we can always do out of pocket if we had to, depending on what therapy group you go to. But we have great people that we work with, and a lot of times there is no charge. We also have one doctor that we work with because we have to have a primary doctor to get home health orders. We have one doctor that will go to your house, and we use him all the time, and he is fantastic because so many people now do not want to go out because of COVID. So we do have a doctor that will come to your house, which is very nice. Okay. Any other questions? Yes. We do Northport. Yes, ma'am. So our service area is Inglewood, Port Charlotte, Boca Grande, Placida. I've even taken that boat across to the multi-million-dollar homes over there. That's nice. I grew up in Inglewood, but yes, so it's Inglewood, Cape Hayes, Northport, Port Charlotte, Punta Gorda, and Arcadia. So we do all of those areas. If we don't cover the area, we have a Venice office, we have a Sarasota office, and we have a Fort Myers office. There's many throughout the state, but those are in our vicinity. Any other questions? You can always call me at any time, and I can answer questions as well. And I will give you all my cards are out at our table, but I will give you my personal. It's my personal as the director is 941 628 8391. And I said I wasn't going to use all my time, and I did. I just got the done. Thank you, everybody. I will go over to the question and answer area, so if you have any further questions, please let me know. Thank you.